I once treated a 72-year-old man who thought his brittle, pale fingernails were just aging. Nothing serious, nothing worth worrying about. Then one morning he woke up dizzy, unsteady, and barely able to speak. And what shocked him most wasn't the stroke. It was learning his fingernails had been warning him for months. I'm Dr. Howard Tucker, neurologist and longevity physician. And today I'm joined by someone whose century of medical wisdom still guides the world, Dr. Shigeaki Hinohara, Japanese physician and global longevity expert. Doctor, thank you for being here.
Thank you. And what you described is something I've seen for decades. Seniors ignore their fingernails because they think nails are cosmetic. But the nail bed is one of the first places blood flow, oxygen levels, and vascular health begin to show distress. Before the big warning signs appear, drooping face, slurred speech, the fingernails whisper the truth, and most people never hear it.
Exactly why we're doing this episode. Stroke signs don't begin with dramatic symptoms. They begin quietly, in the color of the nail, in how fast it grows, in ridges that appear out of nowhere, in pale, weak, or spoon-shaped nails that reveal oxygen problems, circulation issues, and even micro-clotting. And once seniors understand these signs, they can act early, long before a stroke ever occurs.
The best part is that these nail signs are easy to see. No machines, no tests, just awareness. When seniors learn to read these signals, they often catch circulation problems weeks or even months before they become dangerous. That is the power of understanding your own body.
So here's what we're going to explore. First, the nail color changes that reveal dropping oxygen and weak blood flow. Second, the texture shifts that point to hidden inflammation, one of the biggest stroke drivers after 60. Third, the nail growth patterns that tell us when the brain isn't getting enough nutrients. And finally, simple at-home steps to restore circulation and protect your brain starting today.
And we will explain everything in a way that empowers you, not frightens you. Because once you know what these nail signs mean, you feel in control again. You see your fingernails as a window to your circulation and your brain's health. And when seniors act early, they often reverse these changes entirely.
So if you're over 60 and you've noticed pale nails, slow-growing nails, brittle nails, spoon-shaped nails, or vertical lines that weren't there before, stay with us. Your nails may be telling a story about your stroke risk, and by the end of this episode, you'll know exactly what to do next. Let's start with the very first sign seniors tend to overlook, and it's the one that tells me circulation to the brain is dropping long before a stroke. I'm talking about pale or washed out fingernails. When the nails lose their natural pink tone, it means blood isn't reaching the nail bed with the strength it should. And if circulation is weak at the fingertips, it's usually weak in the brain as well. I've seen seniors walk into my clinic with nails so pale they looked almost chalky, and the moment we improved their blood flow, their nails changed before anything else. It's one of the earliest, clearest clues the body gives us.
Yes. And this is something most people never connect to stroke risk. The nail bed is incredibly sensitive. When oxygen drops even slightly, the color fades. When blood vessels narrow because of inflammation or plaque buildup, the nails lose that healthy glow. In Japan, we often teach seniors to check their nail color every morning the same way they check the weather. Because pale nails are not cosmetic, they are vascular. And when you catch that early, you can restore circulation long before the brain suffers.
And one thing I always tell my patients is this: don't compare your nails to someone else's. Compare them to your own baseline. If you've always had pink nails and suddenly they're pale, that's a red flag. If you press the nail and the color takes longer than 2 seconds to return, that's another sign blood isn't moving the way it should. And when circulation slows, the risk of clotting increases. And that's where stroke becomes a real threat.
Exactly. When the nails stay pale, it usually means the vessels inside the body are tightening or blocked. Sometimes from high blood pressure, sometimes from chronic inflammation, sometimes from long-term stress that stiffens the arteries without people realizing it. But the beauty of the nail bed is that it reveals this problem early. And when seniors act early, by improving hydration, boosting movement or supporting the arteries, the nail color often returns before deeper damage takes hold.
And this is why we're starting with pale nails as the first sign, because it's the simplest one to check. Every senior can do it, every day. And if you spot it early, you can reverse the trend and reduce stroke risk dramatically. But pale nails are only the beginning. There's another warning sign that looks like nothing at first, yet it's linked to micro-inflammation inside the arteries. And that's what we'll talk about next. Now let's talk about the second warning sign. And this one is sneaky because most seniors think it's just dryness or aging. I'm talking about vertical ridges on the nails that suddenly become deeper, sharper, or more obvious. These ridges are not random. They happen when the body is fighting chronic inflammation beneath the surface. And inflammation is one of the strongest predictors of stroke after 60. When I see nails with pronounced ridges, it usually tells me the blood vessels are irritated and the arteries are under stress. It's the body whispering that something is wearing down the circulation system long before the brain begins to feel it. Seniors often tell me, "Oh doctor, my nails have always had ridges." But I tell them it's not about having them, it's about when they change. When ridges go from faint to deep, that's when the body is signaling trouble.
Yes, and the reason is very simple. Nails grow from the matrix, a tiny factory under the skin that depends on healthy blood flow, oxygen, and nutrients to produce smooth keratin. When inflammation builds inside the body, the matrix becomes disrupted. Instead of growing smooth layers, it grows uneven ones, which show up as ridges. In Japan, we've observed that seniors with high inflammatory markers often show these nail changes months before developing more serious symptoms. It is like reading tree bark. Deep grooves tell you the environment has been harsh, and the same is true for the nails. They tell the story of stress, inflammation, and sometimes even early vascular damage.
And what's dangerous is that chronic inflammation rarely hurts. It doesn't cause pain, it doesn't cause fever. It works silently, irritating the lining of the arteries and making clots more likely to form. These vertical ridges are one of the few visible clues. And here's something many people don't know. When ridges become deeper on only one or two nails, especially the thumb or index finger, it can indicate inflammation on one side of the body or narrowing in a specific artery. When they appear across all 10 nails, it usually means whole body inflammation, often related to diet, stress, poor sleep, or chronic high blood pressure.
The uplifting part is that ridges often soften when the inflammation calms down. Seniors who improve hydration, increase omega-3 intake, reduce processed foods, and add gentle movement often see their ridges fade within weeks. The nail will begin growing smoother from the cuticle downward. This is why I tell seniors to track their nail texture like a calendar of their health. Smoothness means the body is recovering. Deep ridges mean the body is asking for help. And when we listen early, we strengthen the arteries and protect the brain.
The next warning sign is the one seniors notice most, but understand the least, and that's when their nails start shifting color in ways that don't make sense. I'm talking about nails turning bluish, purplish, gray, or even staying unusually white at the base. These color changes are some of the clearest indicators that oxygen delivery to the tissues is dropping. When the brain isn't receiving steady oxygen, stroke risk rises dramatically, and the fingertips reveal this long before the rest of the body. I once had a patient who said his nails looked cold even when he felt fine, and within weeks we found his oxygen levels falling due to poor circulation. That's why nail color matters. Healthy nails have a warm pink tone. When that tone fades or shifts, it's not cosmetic, it's physiological.
Yes, because nail color is a reflection of blood quality, oxygen saturation, and vascular stability. In Japan, we tell our seniors that the nails are tiny windows into the bloodstream. When the nails turn blue or purple, it means the blood is not carrying enough oxygen or it's not reaching the fingertips quickly enough. This often happens when the arteries stiffen, when blood pressure is unstable, or when the heart is struggling to push blood upward. If the nails turn gray or dull, it often means the red blood cells are not delivering oxygen efficiently, sometimes from anemia, sometimes from chronic stress that reduces microcirculation. And when the nails stay white even at the base, it can reveal early signs of micro-clotting or reduced blood flow to the small vessels that feed the nails.
And here's something seniors rarely hear. These color changes often show up before shortness of breath, dizziness, or fatigue. The fingertips are the far end of the circulation line, so they show distress first. If the nails are blue in cold weather but turn pink again when warmed, that's usually circulation reacting normally. But if the blue or purple shade stays even when you're warm, that's a sign blood isn't reaching the brain with the force it should. The same goes for nails that look unusually white or milky. It means the nail bed isn't being filled with oxygen-rich blood. And when we see that consistently, we look for deeper vascular issues.
The hopeful part is that nail color often improves quickly when circulation improves. Seniors who start gentle daily movement, hydrate consistently, increase iron-rich foods, manage stress, and improve breathing habits often see their nails brighten within days. That's why I tell seniors not to fear nail color changes, but to treat them as early invitations to support their arteries and oxygen flow. When the nails return to healthy pink, it often means the brain is receiving stronger, safer blood flow as well. And every improvement you see at your fingertips is a quiet sign your stroke risk is going down.
Now let's talk about something most seniors never think about at all, and yet it's one of the strongest predictors of circulation strength and stroke risk: how fast or how slowly your nails grow. Healthy nails grow at a steady pace, about 2 to 3 millimeters per month. When nail growth suddenly slows, stalls, or becomes inconsistent from one nail to the next, it usually means the body isn't delivering enough nutrients, oxygen, or blood flow to the nail matrix. And here's the important part: the same arteries that feed the nails also feed the brain. So when nail growth slows down, it often mirrors what's happening inside the arteries leading to the brain. I tell my patients to pay attention when their nails feel like they're taking forever to grow, because that often means something deeper is slowing too.
Yes, and the nail matrix is extremely sensitive to the supply of nutrients like biotin, zinc, iron, and essential fatty acids. But even more importantly, it depends on strong microcirculation, the tiny vessels that bring oxygen to the fingertips. When those vessels weaken, nails grow thin or slow, and the brain receives fewer nutrients as well. In Japan, we watch nail growth closely because it changes long before blood tests show trouble. When nails grow slowly, we think about hidden anemia, chronic inflammation, low protein intake, or stiffened arteries. And when one nail grows much slower than the others, it can indicate poor blood flow in that specific finger, sometimes reflecting early vascular narrowing on one side of the body.
What's encouraging is that nail growth often improves quickly when circulation improves. Seniors who hydrate more, increase protein intake, add omega-3s, walk a few extra minutes a day, or reduce inflammation through diet often see faster nail growth within weeks. And that's why nails are such powerful early warning signs. They tell you how well blood, oxygen, and nutrients are moving through your body. When nails grow strong and steady, the brain is usually receiving what it needs too. Now we need to talk about the signs that seniors should never brush off, because these aren't gentle warnings. They're the body raising a flag that something may already be happening inside the arteries. And the first one is dark vertical lines under the nails. These tiny lines, almost like splinters, are often dismissed as bruises or minor injuries. But when they appear without trauma, they can reveal micro-clotting or inflammation inside the small vessels. I've seen patients ignore these for weeks, and by the time they came in, their blood flow was already compromised. The next dangerous sign is nails that suddenly curve downward or become rounded like the back of a spoon. This shape change is often tied to chronic low oxygen, heart strain, or lung issues that silently increase stroke risk. These are the signs you never want to overlook.
Yes, because these changes show the deeper systems are already struggling. In Japan, when we see dark streaks or splinter-like lines, we immediately look at the blood vessels and oxygen levels. These lines can be early indicators of inflammation inside the arteries or tiny clots traveling through the bloodstream. And when nails begin curving downward, what we call clubbing, it often means the body has been compensating for low oxygen for a long time. The same lack of oxygen affecting the nails is also affecting the brain. Another dangerous sign is nails that separate from the nail bed, lifting up or creating gaps. This often reveals thyroid imbalance, circulation weakness, or infections that strain the heart and blood vessels. When the nail lifts, it means the blood flow underneath is unstable.
And I want seniors listening right now to understand this clearly. These signs don't mean panic, they mean action. Nails rarely change shape or detach overnight. These shifts happen gradually, giving you plenty of time to respond if you know what they mean. When I see these signs, I immediately focus on improving blood flow, lowering inflammation, and strengthening oxygen delivery. Even simple steps like hydration, walking, deep breathing exercises, and nutrient support can start reversing these patterns. But ignoring them is what leads to danger.
Exactly. Nails are honest. They show what the body won't say out loud. And when seniors learn to read these signs, they catch problems early, far before a stroke occurs. The goal isn't fear, it's awareness, and with awareness comes control.
Now that we've covered the warning signs, let's shift to something far more empowering. How seniors can strengthen their nails in a way that directly supports circulation and reduces stroke risk. And the first thing I always emphasize is hydration, because poor hydration thickens the blood and slows nutrient delivery to the nail matrix and the brain. When seniors start drinking enough water, their nails often become smoother and brighter within days. The second step is increasing protein intake. Nails are made of keratin, and keratin needs amino acids. Without enough protein, the nails weaken, circulation slows, and the brain loses fuel. And the third step is simple movement. Even 5 to 10 minutes of walking or calf pumping can dramatically increase blood flow to the fingertips and the brain. Movement is medicine, and nails reveal the benefits faster than almost any other part of the body.
Yes, and in Japan we teach seniors a concept called micro-circulation care. It means supporting the tiny blood vessels that feed both the nails and the brain. One powerful way to do this is improving the quality of fats you consume. Omega-3 fatty acids from salmon, sardines, or flaxseed oil make blood flow smoother and reduce the inflammation that causes deep ridges or pale nails. Another key is improving iron absorption. Seniors often become mildly anemic without noticing, and the nails are the first to reveal it. Eating iron-rich foods like spinach, eggs, or beans paired with vitamin C helps restore healthy nail color and oxygen delivery to the brain. And something many people forget is nail massage. A gentle 2-minute massage at the base of each nail improves blood flow to the nail matrix and stimulates the same vessels that supply the brain. It is small but powerful.
And I want to emphasize the importance of managing stress, because chronic stress constricts the tiny vessels that feed the nails and starves the brain of oxygen. Simple deep breathing, slow exhaling, or relaxing before bed can improve both nail growth and brain clarity. Another overlooked factor is sleep. When seniors sleep well, their nails grow faster and smoother because the body repairs the vessels during the night. And finally, reducing sugar and processed foods is critical. Sugar fuels inflammation that shows up as ridges, discoloration, and slow nail growth. And that same inflammation damages the arteries that protect the brain.
Exactly. When seniors take these steps, their nails begin to look healthier. They regain color, they regain strength, they grow steadily. And these improvements are not cosmetic. They reflect stronger blood flow, lower inflammation, and better oxygen delivery to the brain. When the nails improve, the circulation improves. And when the circulation improves, stroke risk drops. Seniors have more control over this than they realize.
So as we wrap up today's episode, I want every senior listening to pause for just a moment and look down at their own fingernails. Those tiny surfaces have been telling you a story about your circulation, your oxygen levels, your inflammation, and even your stroke risk, long before symptoms ever appear. And the most empowering part is that these signs are visible. They're accessible. You don't need a blood test or a doctor's office to spot them. You just need awareness. Because when you notice pale nails, slow growth, deep ridges, dark streaks, or sudden color changes, you're not seeing aging. You're seeing early warnings. And early warnings mean you have time to protect your brain, strengthen your arteries, and improve your circulation before anything dangerous happens. That's the beauty of what we've covered today.
Yes, and this is why I always remind seniors that the body does not fail suddenly. It whispers, it signals, it asks for help long before crisis arrives. But most people were never taught to read the signals, especially in the nails. The nails are honest. They reflect the state of your blood flow, your oxygen supply, and your nutrient absorption. And when you care for these small signs, you are caring for the deeper systems that keep you alive and strong. I have practiced medicine for over a century, and I can tell you that seniors who listen to their bodies stay independent longer. They move with more confidence, they trust their strength, and they avoid the silent dangers that catch others by surprise.
And that is our goal with every episode, to give you knowledge that keeps you ahead, to help you see patterns early, to help you stay strong, steady, clear, and protected. If your nails are warning you today, this is your moment to respond. Hydrate more, move more, support your circulation, reduce inflammation, pay attention to your body's earliest messages. Small actions now lead to big victories later.
Exactly, and I want every listener to remember one simple truth. When your nails begin to look healthier, it is not just cosmetic. It is a reflection of healing happening deep inside your body. The blood is flowing better. The brain is receiving what it needs. The risk is going down. This is the power of awareness.
Thank you for joining us. If you watched until the end, let us know in the comments. Tell us which sign surprised you most. And stay with us for our next episode, because your health, your clarity, and your independence matter more than anything. Until then, take care of yourself and keep listening to what your body is trying to tell you.